Hi everyone, it's Philip here from Vet Education. Thank you so much for joining us for this short broadcast there. Just a little bit of an update on some of the lectures that we've been listening to this week in the World Small Animal Veterinary Association Congress in the city of Singapore. What I want to talk to you today about is feline hypertrophic or feline cardiomyopathies. Now, there are a number of cardiomyopathies that are described in the literature, and one of the take-home messages from this particular lecture was that we really just need to be thinking about feline cardiomyopathies as pretty much the same disease. There's hypertrophic, there's dilative, restrictive, there's even outflow obstructive hypertrophic cardiomyopathy, and it is most helpful for us to describe all of these as just feline cardiomyopathy. There's a high probability, in fact, that most of these conditions are in fact a continuum of the same disease, and it may well be that we're describing different periodical manifestations of hypertrophic cardiomyopathy. So the bulk of the discussion in this particular lecture focused on hypertrophic cardiomyopathy in cats. One of the really interesting things that came out of this particular lecture was the demographic spread of cats with hypertrophic cardiomyopathy. In fact, it affects 1 in 7 cats, predominantly in male cats, much far greater than female cats, cats of older age, and cats with a greater body weight as well. There's a genetic influence in ragdoll and Maine Coon cats as well. It's been described in the literature. Now, to focus on treatment of cardiomyopathy in cats, this was really interesting. The standard treatment that is currently recommended just involves the use of 2 medications. One of those medications is furosemide, starting off with a dose of 1 to 2 milligrams per kilo twice a day. And the second is the administration of clopidogrel, which is shown to have give rise to, in one study, to a life expectancy twice as long as cats that are treated with aspirin. So if you're going to go for an anticoagulant, antiplatelet drug, go for clopidogrel over aspirin. In terms of the other cardiac medications that we may use, such as pymabendan, for example, ACE inhibitors, beta blockers, and diltiazem, there's very little evidence to support the use of any of these medications. However, in fact, pymabendan, for example, is actually, if you read the drug label, contraindicated in cases of aortic outflow obstruction and in cases of diastolic failure in patients because it's a positive inotrope. However, there was one study that showed an improvement in life expectancy in cats in clinical cases that were given pymabendan over those that were not. And so there may be circumstances in which we might consider adding pymabendan perhaps to the treatment regime of a cat with hypertrophic cardiomyopathy. It's really important, though, that these cats, if you are going to use pymabendan, that they have actually clinical disease, clinical signs of congestive heart failure present, and that they don't have ultrasonographic evidence of an aortic outflow obstruction. So that systolic anterior motion of the mitral valve leaflets that can occur, and the bulging of that intraventricular septum into the aortic outflow tract. If that is not present, then you could consider giving pymabendan. If it is present, then that may be a relative contraindication to giving pymabendan, because obviously we don't want to increase the force of ventricular ejection against an obstructed aortic outflow tract. As far as other medications are concerned, with diltiazem, there's no therapeutic benefit for diltiazem in the routine management of patients with hypertrophic cardiomyopathy unless that patient has atrial fibrillation or a supraventricular tachycardia, in which case it's a very beneficial medication. For beta blockers as well, there's no benefit. It may worsen congestive heart failure in some patients as well. And ACE inhibitors are of no real proven benefit. However, you could consider the use of ACE inhibitors if you have a patient on furosemide therapy as well as clopidogrel therapy that perhaps is tolerant of having an additional medication. It doesn't get too stressed when it's being medicated, to help reduce unchecked activation of the renin-angiotensin-aldosterone system. As far as monitoring these patients is concerned, respiratory rate when the cat is sleeping at home in their home environment where they're not stressed is deemed to be the most appropriate method of monitoring these patients, and as an aid to dictating whether or not you need to alter the dose of furosemide in particular in these patients as well. well. A target respiratory rate is one that's less than 30 breaths per minute, and there are a couple of apps available on the market that will help owners to document their cat's respiratory rate. In terms of prognosis, the median survival time for cats once they are clinically affected with signs of congestive heart failure with cardiomyopathy is around 9 to 12 months, with about 50% of cats still alive 1 year after diagnosis. So those are just some of the tips from a very, very informative lecture on hypertrophic cardiomyopathy in cats and our current understanding of how to diagnose and manage these patients. I hope you found this short summary useful. We'll try to put a little bit more information up on our website in the coming weeks as well. And if you're interested, please give us an email at info@veteducation.com.au. Thanks very much for joining us.